This is video 2, movements. So in this video, we're talking about two things primarily. We're talking about planes and we're talking about movements. So in the last video, we defined directional terms, and now when we talk about movements, we're going to have an application for those directional terms. And we'll use those directional terms along with the planes to help to define the movements. And so in the greater scheme of studying anatomy, the relevance of this is that we need to be able to have these movements that we can define so that we can talk about what actions happen at each of the joints and the actions that each muscle is responsible for. So we're on our path to that. So the first thing we're talking about today then is planes. So planes, what is a plane? Do you remember planes from geometry class in high school? It's not a point, it's not a line, it's one more dimension. It's a flat surface is what a plane is. And so we can kind of think about inserting a plane anywhere in the body, and we use that for a couple of things. One is for cuts. So like if we're looking inside the body, say we've cut the body down the middle, or if we've cut the body, some way or another, and we're looking at a cross section, we use those planes to describe where that cut was made, along which plane was that cut made, so that we can get our bearings and understand what we're looking at. So we use planes for cuts when we're looking at cross-sectional images of the body, but we also use the planes for movements when we're, when we're moving a body part. We can be moving along one plane or another. So there are three main planes that we use for movements and for most of the cuts in the body that we might be using for looking at cross-sections. And we'll look at those three planes right now. So my assistants are here, ready to help out. Okay, so remember, a plane is just a flat surface. You can, in a way, think of it as a sheet of glass inserted into the body, especially when we're talking about a cut. But it's a surface, and so it's a surface you can move along, and it's a surface that you could cut along, in essence. And that's what we're going to do with our three assistants today. So our three main planes. This first assistant is going to demonstrate for us the sagittal plane. Okay, ready? Sagittal plane divides the body into right and left portions. Okay, so there's the sagittal plane. So I've made a sagittal cut, and this actually is mid-sagittal, meaning it's right along midline, more or less. And it divides the body into right and left portions. We could talk about a parasagittal plane too, that divides the body into unequal right and left portions. But anything that's parallel to this cut or to this line would be a sagittal cut or the sagittal plane. Okay, so sagittal plane divides the body into either equal or unequal right and left portions. That's sagittal. Our next plane is frontal or coronal. So in the body, so if this was a head of a human, we have the frontal bone here as the most anterior part of the cranium, and then there's a suture between the frontal bone and the parietal bones, and that's called the coronal suture, and or the frontal. I think it's usually called the coronal suture. So coronal means crown, or corona means crown, and refers to the top of the head. So this suture is called the coronal suture, and the plane that essentially runs through that suture is called the coronal suture, or the coronal plane or the frontal plane. So coronal or frontal plane is like this, and it divides the body into anterior and posterior portions. Okay, so the frontal or coronal plane divides the body into anterior and posterior portions. That's the frontal plane, also known as the coronal plane. Coronal meaning crown, referring to that suture on the top of the head. Okay, our third plane, so let's see, we had sagittal or mid-sagittal or parasagittal. We could talk about different sagittal planes. We had frontal or coronal. Our third plane is the horizontal plane or transverse plane. So the horizontal or transverse plane divides the body into superior and inferior portions. Okay, superior and inferior divisions happen along the transverse or horizontal plane. So two terms for that plane, either transverse or horizontal, and they're dividing the body into an upper and a lower portion, or a superior and an inferior portion. There is an additional plane that we see sometimes. These are the three main ones. Sometimes we'll see an oblique plane used also. Oblique just means that it's at an angle, and it's no specific angle in no specific location, but a plane at an angle like that, that's an oblique plane. Okay, so we have oblique, we have transverse or horizontal, we have frontal or coronal, dividing the body into anterior and posterior portions, and we have sagittal. This is mid-sagittal. If we had a plane like this, we could call this parasagittal, where it's parallel to the mid-sagittal plane, but it's not right along midline, so it's not mid-sagittal. But any of these we could just call sagittal. Okay, so those are our planes, and now we're going to put planes together with our directional terms and come up with all of the movements that happen in the body. Okay, so here's our next part on movements. So, like I said before, movements are movements. Okay, that's pretty obvious. But what we're doing when we're talking about movements is we're defining what action happens at each of the joints of the body. So there are lots and lots of joints in the body, and each of them moves in only very specific ways. And we in order to learn about joints and in order to learn about muscles, we have to be able to define these movements so we can say what actions these muscles are doing on the joints that they cross. So let's go through. First, let's go through and just define a number of the different movements of the body. We'll define the major ones, and then we'll go through and talk about the movements of the axial skeleton, and then we'll go through and talk about the movements of the appendicular skeleton. So first, some definitions of some basic movements. So many movements go in pairs, like the directional terms do, but not all of them. So the first two are flexion and extension. So flexion is a decreasing of the angle of the joint, and extension is an increasing of the angle of the joint. So for instance, flexion of the elbow, we're decreasing the angle of the joint. So here the joint's at 180 degrees. Here's the joint's at 90 degrees. We've decreased the angle of the joint. Its opposite, extension, is increasing the angle of the joint. Okay, flexion, extension, and we'll see how flexion and extension show up on lots of different joints in the body. Let's see, so we have flexion, extension, we have rotation. So depending on where the rotation is, the rotation either will be defined as a medial or lateral rotation. For instance, like if it's in a limb, we'll talk about medial rotation or lateral rotation. But if it's in the torso, we'll just talk about rotation as rotation. Let's see, we have abduction and adduction. So adduction is when a body part moves toward the midline. Adduction, and abduction is when it moves away from the midline. That's abduction. Let's see, flexion, extension, abduction, adduction. We also could do a horizontal abduction and adduction in some places. We'll talk about those when we get to those joints. Let's see, what else? And rotation. Let's see, supination and pronation. Let's talk about some of these other ones when we get to the specific joints that carry out those actions. Okay, so let's start with the axial skeleton, and the movements that happen along the axial skeleton. So remember, the axial skeleton is the skull and the spine and the rib cage. So actions that happen there. So let's start with the neck and the head. So there are only a few actions that happen in the axial skeleton. So first is flexion, extension. So flexion is decreasing the angle of the joint. Extension is increasing the angle of the joint. So we kind of need to know where the angle of the joint is for that to make sense.
but what we're talking about is the cervical spine here, and flexion and extension. Usually in flexion, the body part that is moving moves anteriorly, and in extension, the body part that's moving moves posteriorly, but not 100% of the time. But that's a good rule of thumb to kind of keep in mind. So we could talk about flexion as just happening right at the junction between the head and the neck, flexion and extension, flexion, extension. Or we could talk about it happening along the entire cervical spine, flexion, extension. Now we also could say flexion, and extension being returning to anatomical position and then going back beyond anatomical position. We could talk about that as hyperextension. So you see it described differently in different texts. Sometimes anything from this flexion position to the most extended position would all be called extension, but sometimes we could go from this flexion position to anatomical position being extension, and then beyond anatomical position being hyperextension. And then let's look at flexion, extension. So in the rest of the spine, flexion, extension. Okay, so flexion and extension in the spine. Let's look at a variation of flexion, which is lateral flexion that happens in the spine. So lateral flexion, it doesn't matter which side we're going to, we're going to call this lateral flexion. We can do it in the neck, lateral flexion, and we can do it in the entire spine, lateral flexion. Okay, so we have flexion, we have extension, we have lateral flexion. Also in the axial skeleton, we can do rotation. So again, we could just do rotation of the neck and head, rotation here. And we can do rotation of the entire spine, rotation. And so when it's happening in the axial skeleton, we don't have to say, is this medial rotation, is this lateral rotation, because it is the center of the body and it is just rotating around itself, its own axis. And so we just need to call this rotation, okay? Couple of other actions of the axial skeleton. We can move the pelvis. I guess actually moving the pelvis would be moving the girdle of the lower extremity, and the pelvic girdle, which is not exactly the axial skeleton, but you can see this movement if we move the pelvic girdle. So anyway, we have an anterior pelvic tilt. So moving the pelvic girdle is really moving both the axial skeleton and the pelvic girdle. This is an anterior pelvic tilt. This is a posterior pelvic tilt. So the part that's happening in the spine, anterior pelvic tilt, we're exaggerating the lordosis of the low back. Posterior pelvic tilt, we're flattening that curve of the low back. Okay, anterior pelvic tilt, posterior pelvic tilt. A couple of other axial skeleton actions are things that happen in the head. So the jaw is the most mobile part of the head, and it has a few actions that it does. So we have lateral deviation. Okay, that's lateral deviation, and of the jaw or of the mandible. We have protraction and retraction. So protraction is the jaw coming forward, protraction, and then retraction is it coming back into anatomical position. So protraction, retraction. Okay, protraction, retraction. Okay, elevation and depression also happen in the jaw. So depression and elevation is closing the mouth. Depression is opening the mouth. Elevation is closing the mouth. Okay, so depression, elevation. Okay, so those are axial skeleton movements. Coming up next is our last part, which is movements of the shoulder girdle and upper extremity, and movements of the pelvic girdle and lower extremity. Okay, let's take a look at movements of the shoulder. So the shoulder is a ball and socket joint of the 6 different types of synovial joints. The shoulder and the hip are both ball and socket joints, and so we're going to see similar movements happening at those joints. So shoulder actions, flexion and extension. Okay, let's look at it from the side. Flexion, and extension. So flexion, we're decreasing the angle of the joint, which means the angle of this joint, when it's like this joint is considered open in a sense, which seems kind of funny. But if we imagine an imaginary line coming from above and going through the shoulder joint, and this line right now is at 180 degrees, and if I go like this, it's now at 90 degrees. If I go like this, it's now at 0 degrees. Okay, so going from here to here, I'm decreasing the angle of the joint, right? So this is flexion. Also notice that the part of the body that's moving is moving anteriorly. In flexion and extension, let's put the planes into all of this. In flexion and extension, the movement happens along the sagittal plane. And that's the same thing is true for the flexion and extension that we saw in the axial skeleton. The movement happens in or along the sagittal plane. Okay, flexion, extension of the shoulder, flexion, extension of the torso or of the spine. And so the shoulder, yes, does hyperextension. So again, we could call this flexion, we could call all of this extension, or we could call this flexion, and we could call this extension, we could call this hyperextension if we wanted to. Typically, this whole thing is just called extension. All right, flexion, extension, all happening, flexion and extension, all happening along the sagittal plane. Flexion, extension. So those are the first two movements of the shoulder. Next movements of the shoulder, abduction and adduction. Abduction, adduction. So abduction and adduction are movements away from the midline, abduction, and movements toward the midline, that's adduction. And abduction and adduction happen along the frontal plane or the coronal plane. Okay, abduction away from midline along the frontal plane, adduction toward the midline along the frontal plane. We can do a rotation in the shoulder. So medial rotation, lateral rotation. So we're pivoting here, medial rotation, lateral rotation. So from anatomical position, we're rotating toward midline here and away from midline here. Another way to demonstrate this so that we can kind of take any rotation that's happening in the forearm out of what we're seeing is like this. So here just the shoulder is rotating, medial rotation, lateral rotation, medial rotation, lateral rotation. So a rotation just is a pivot around a point. So we don't talk about it happening in a plane so much, the way flexion, extension, abduction, and adduction are happening in a plane. The shoulder joint also does horizontal adduction, horizontal abduction. So here we still have abduction and adduction where we're moving toward the midline, adduction, or away from the midline, abduction, but now it's in the horizontal plane. So horizontal adduction, horizontal abduction, okay? Another action that happens in the shoulder is circumduction. So there are only a few of the bigger joints that can do, not bigger, but rounder joints. So ball and socket joints can do circumduction. So circumduction is this. Circumduction is tracing a circle with the most distal part of the body that's moving. That's circumduction. Okay, so the shoulder being a ball and socket joint can do circumduction. So those are movements of the shoulder. Let's come in a little bit and look at the shoulder girdle. So the shoulder girdle, which we'll talk about in video 3, is the clavicle and the scapula. And it moves also separately from the shoulder itself. The shoulder, of course, is the articulation between the scapula and the humerus. So the shoulder girdle can move separately from the shoulder, and those movements include elevation, depression. So those are movements of the shoulder girdle. Elevation, depression. The shoulder girdle can do protraction and retraction. So remember, protraction and retraction are a forward movement and a posterior movement. Protraction, retraction. We saw that also in the mandible. Remember, protraction and then retraction is coming back to anatomical position. With the shoulder girdle, we can also call protraction abduction because we're moving away from the midline. So the two scapula are moving away from midline with protraction, and they're moving back toward midline with retraction. So we can call it protraction, retraction, or we can call it abduction, adduction. So those are movements of the shoulder girdle. The last movement of the shoulder girdle is a rotation. So a rotation of the shoulder girdle, what's happening here is the point that is rotating around is essentially the middle of the scapula. And we start to, in order to see this, we start like this. And then, so if we can imagine where the scapula is, and after our scapula video, we'll imagine this so much more clearly. We're going to move the arm up like this, but what's happening in this movement is the scapula is rotating in a way that's called upward rotation or lateral rotation when I go from here to here. So the scapula starts here, so if my hand is representing the scapula, when I do this, it rotates like that. Okay, when I come down, it rotates back down again. So lateral rotation and medial rotation, or upward rotation and downward rotation. We'll talk about those more when we talk about the movements of the shoulder girdle. Okay, more upper extremity movements. If we look at the elbow is more or less a hinge joint, and so it's pretty straightforward. It does flexion, extension. Gotta love that. Very simple, flexion, extension. So here we go though, flexion. We're moving along the sagittal plane. The body part that's moving is moving anteriorly, so it fits with our definition of flexion, right? Flexion, extension. And remember the shoulder also did flexion, extension. Here it is in the elbow, flexion, extension. We can do it in the wrist, flexion, extension, hyperextension. If we move down from the elbow, we have the proximal and distal radial ulnar joints. The proximal and distal radial ulnar joints do pronation and supination. So supination, pronation, supination, pronation. Okay, so that's a little bit of a unique, so it's a, pronation and supination are essentially rotation type movements that are unique to, we can do it in the foot and we can do it in the, at the proximal and distal radial ulnar joints. Pronation, supination. At the wrist, we have a few movements that happen. So we already talked about flexion, extension that happen in the wrist. Can we see that? Flexion, extension in the wrist. We also have ulnar deviation and radial deviation. Ulnar deviation, radial deviation, which we could call adduction, abduction. So from anatomical position, we can see that we're moving toward midline when we do ulnar deviation, and away from midline when we do radial deviation. But we like to be more specific about what movements happening here, and if we can refer to the movement from the nearby parts of the body, this kind of makes more sense. Like, you know, saying ulnar deviation means something more, and radial deviation, okay? Ulnar deviation, radial deviation. And we can do a circumduction in the wrist, which is a combination of some of these other movements. In the hand, we have, of the fingers, we have abduction and adduction. Can we see that? Abduction, adduction. So here, abduction, we're moving away from the midline of the hand. So this is abduction, and adduction moving toward the midline of the hand. And then of course we have flexion, extension that happens in the hand of the various joints. And again, we'll talk about those more specifically when we get to those joints. But flexion, extension, we have a unique movement in the hand opposition, where the thumb can go across and reach the other fingers. That's opposition. Okay, let's take a look at the hip. So the hip, very much like the shoulder, the hip can do flexion, extension, and we can call this flexion, extension, hyperextension, or we can call it flexion, and we can call it extension. That's flexion and extension in the hip, holds with our definition, right? We have a body part moving anteriorly for flexion along the sagittal plane, but remember that anterior movement isn't going to hold up in all of our examples of flexion. Extension, we have a body part moving posteriorly, and we're moving along the sagittal plane. In the hip, we have abduction, adduction. So we're moving along the frontal plane or the coronal plane. Abduction, adduction, abduction is away from midline, adduction is toward midline. The hip can also do horizontal abduction, horizontal adduction, and it can do circumduction, like the shoulder can, and we can do a medial rotation and a lateral rotation. And sometimes we'll call this something different, but But to stick with the same terminology for now, let's say medial rotation, lateral rotation, and that's of the hip. So those are the hip movements. In the knee, we can do flexion, extension, flexion, extension. So the knee is an exception as far as flexion extension goes. So if I'm in an anatomical position and I flex my knee, I now have a body part moving posteriorly. So this is one of those exceptions. For the most part, flexion is going to have a body part moving anteriorly. Here in the knee, it moves posteriorly from anatomical position. This is flexion of the knee. This is extension of the knee. The knee also does a slight medial and lateral rotation, which only happens when the knee is bent. So medial rotation, lateral rotation. I'm trying not to move my foot, my ankle separately so you can see this action. Medial rotation, lateral rotation only happens in flexion because in extension, the knee needs to be more stable, so we need to not have that rotation happening. In the foot, let's see what happens in the foot here. So in the foot, we have plantar flexion, dorsiflexion. So plantar flexion, we're moving the foot in the plantar direction. Dorsiflexion, we're moving the foot in the dorsal direction. We have inversion and eversion. So inversion, eversion. Can you see that? Inversion, eversion. And what else? We can do a rotation in the ankle, which is a combination of various, not a rotation, sorry, a circumduction, which is a combination of a few different movements. And something else in the toes. The toes are just like the fingers, flexion, extension. Let's do this more specifically. Flexion, extension, abduction, adduction, same thing in the toes as it is in the fingers. So those are our movements of the body. So we talked about planes, we talked about movements. Your response word for this video is move. So remember, your response word for the first video was skeleton. Your response word for the second video is move. And so I want you to practice these movements and use the book. There are great diagrams in the book. And also in the book there are more, it gets into more subtle movements, which we will get into as we get into each of those body parts. But I just wanted to cover the basic movements so that we have those down and can move ahead and start talking about joints and muscles and actions and all of that. Okay, so that's it for video 2. We talked about planes, we talked about movements. In video 3, we're going to go ahead and start to dive in and look at the shoulder girdle. So we'll look at the clavicle and the scapula and all of their parts and joints. Okay, that's it for video 2.